BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Stem cell hair rejuvenation limitations matter because this treatment can only support hair when follicles are still alive. When follicles are missing, closed, or no longer producing hair, a different approach becomes necessary. This is BeautySeek, a network of straight talk about aesthetic procedures so that beauty seekers can make confident choices. If you've undergone stem cell hair rejuvenation or you provide these treatments, comment or DM us so our BeautySeek community can learn from your experience. We'd love to share your story. Stem cell hair rejuvenation limitations typically appear during microscopic evaluation, when a provider magnifies the scalp and sees that follicles are no longer present. Regenerative treatments cannot create new openings or generate hair in those areas. Patients with long-standing bald patches or areas with no visible follicle openings usually need a treatment approach designed for missing follicles rather than weakened ones. Regenerative alternatives to stem cell hair rejuvenation offer support when follicles are still present but not performing strongly. Options include surgical hair restoration options. They become relevant when regenerative treatments cannot help because follicles are missing. These treatments place new follicles into areas where none remain. FUE hair transplantation involves removing individual follicular units from a donor area, usually the back of the scalp, and placing them into thinning or bald regions. FUE is chosen for its small entry points and its ability to place follicles precisely. FUT hair transplantation removes a narrow strip of tissue from the donor area, which is then separated into grafts. FUT is sometimes selected when patients need a higher number of grafts in one session. Both approaches are performed by trained surgical providers and are designed for cases where follicles no longer exist in the areas of concern. Stem cell hair rejuvenation consultation questions can guide your next steps. A helpful question for you to ask your provider is, if my follicles are not active enough for stem cell hair rejuvenation, which regenerative or surgical option may make the most sense for the type of hair loss that I have? Stories from patients in the BeautySeek community help others understand how different treatments fit different scalp conditions. If you've tried or provide FUE or FUT, comment or DM us so your experience can support someone preparing for their hair rejuvenation journey. We would love to share your story. If stem cell hair rejuvenation is not the right solution for you, two major paths are worth exploring in depth. FUE for transplanting individual follicles and FUT for maximizing graft count in a single session. We'll explore these surgical options next, right here on BeautySeek.